My name is Niaz Rahim, and I am another host of today's program. And it's my pleasure to be a part of today's clinical and diagnostic microbiology session. So I'm glad to introduce our third speaker today, Dr. Muhammad Rubaid Hassan. Dr. Hassan is the clinical molecular microbiologist at the Department of Pathology, Sidra Medicine, and assistant professor of clinical pathology, Will Cornell Medical College, Qatar. Dr. Muhammad Rubaid Hassan earned his BSc and MSc in biochemistry from University of Dhaka, then PhD from Keishu Institute of Technology, Japan. He spent most of his career in clinical microbiology. At this capacity, he provides clinical and scientific oversight of routine and specialized molecular diagnostic testings of infectious diseases in lab. So Dr. Hassan earned certification in clinical microbiology from American Board of Medical Microbiology and Canadian College of Microbiology. So, Dr. Muhammad Rubaid Hassan, you have 15 minutes for the presentation. I will give you two reminders after 12 minutes and after 14 minutes for your convenience. Now, I would like to hand over the floor to you, Dr. Hassan. Thank you.
Thank you very much, Niaz, for great introduction. This is a great pleasure again to come back to this ISBM webinar series. I think I first want to say that, regardless, I may not be very young by age, but I'm really young as a clinical microbiologist, especially compared to all the speakers who are talking with me today in this webinar. I already know Dr. Morshed and Dr. Samir very well. And Dr. Brad Kay, it's really wonderful to know you. I also worked in ICD-DRB, actually my first introduction to clinical microbiology in ICD-DRB when I started as a master's thesis student in the enteric bacteriology lab. So I was there on and off until the end of 1999 and before leaving the country. So again, I just want to say that actually after that ICD-DRB, I in my PhD and subsequent postdocs, I was not really in clinical microbiology. So me becoming a clinical microbiologist is a kind of coincidence. I still remember in 2009 when I moved to Vancouver and I met Dr. Moshe there, and he mentioned about this, which was totally new to me. And coincidentally, 2 years after that, I started as a lab scientist in BC Children's Hospital in Vancouver, Canada, and where I got my introduction to this field. And then thereafter, I started working to progress my career as a clinical microbiologist. So I think a lot of things I want to say has already been said by Dr. Morshed, and I would not elaborate too much on the repeated things. However, before actually talking about the career path, I want to give you a slight flavor of how the life of a clinical microbiologist at work. So as you can see, Sunday morning at the wound bench, I mean, say it can be any day, any weekday. So you're having a lab round and you are going after different benches. And at the wound bench, you got a question from a technologist. So the specimen was a superficial wound swab from the buttock of a 2-year-old boy. And the gram staining was showing no neutrophil, no organism scenes. However, by culture, there was slight growth of E. coli, Klebsiella pneumoniae, and Staph epidermidis. So the question is how to report these results. So I think this is where the microbiologist job comes. If I show you that, so you see all these things highlighted here are important in interpreting this result. First of all, see the specimen. What is the specimen? It is a superficial wound. That means it's an outside. And the age of the patient is a 2-year-old boy. And sorry, I missed look at the body side as well, buttock. So a two-year-old boy may not, can keep his buttock clean enough that there will be no fecal flora there. And also gram staining is showing no neutrophil, which suggests there is probably no serious infection there. So, and moreover, all the organisms you see here are common fecal flora. So, so this is ideally you'd report it as probably a mixed enteric flora or mixed organisms, and a clinical correlation or significance need to be evaluated, something like this. So this is where microbiologists work in interpreting the test. Next example, it's actually, I'm on call now, and this happened actually 2 days ago. So late night after dinner, you were just waiting to relax, but you got a call from the lab that there is a positive blood culture with gram-positive cocci in chains. And in your lab, you use the MALDI-TOF to quickly identify bacteria, even directly from the blood culture bottle. And it gives you an identification of Viridans group streptococci with a score of 1.8, which is lower than normal. So the question is this really a significant result, or is this a contamination during collection or something? So then you go to the patient chart and you review the patient. It's a 7-month-old boy who was presented to emergency with fever, shortness of breath, and cough, and chest X-ray showing right-sided pneumonia. However, the patient condition was not very serious. So the patient was actually discharged without antibiotics. Now, as a microbiologist, you know that your MALDI-TOF is pretty good in identifying in many of the species, but there is a problem with the differentiating Viridans group streptococci against Streptococcus pneumoniae. So in this clinical context, you think that this might, because there is a chest X-ray showing right-sided pneumonia, shortness of breath, cough, fever, everything fits more with like a Streptococcus pneumoniae. So you are not too satisfied with the MALDI-TOF result. So you ask the technologist, could you please run a molecular test, say BioFire BCID, blood culture identification PCR panel, so which is basically a rapid molecular test to run on the positive blood culture. And your suspicion was correct. It was identified as Streptococcus pneumoniae. So this finding was very important because this patient need to be put on antibiotic. So you call the ED directly and then ask them so that they call the patient back in. And the patient was brought back in and was given ceftriaxone, which is the recommended empirical treatment in this context. So this is another thing. So you need to know the limitation of the technology as a microbiologist. Third example, you have a positive blood culture with gram-negative rod, and MALDI-TOF identified it as a Klebsiella pneumoniae. And you have a rapid molecular test in your lab, which detected a gene called CTXM, which indicates that this organism may be producing extended spectrum beta-lactamase. However, you found the patient is on ceftriaxone, and it is known that even third generation cephalosporins may lead to therapeutic failure in bacteremia with ESBL producing Enterobacterialis. So you call the doctor immediately to change the antibiotic management. So this means responsibility. So that means you need to be vigilant so that your patient are safe. So, I mean, these are some examples of, how a clinical microbiologist works in the laboratory. So, and as you can see, it is really not an exact science. So the job of the clinical microbiologist is to translate and communicate lab results in a clinically meaningful and useful manner. So it may happen to sometimes that you do not report things as you found it in the bench. So I try to list the responsibilities of a clinical microbiologist, but you would see that it is not universal because it varies by country and by the laboratory, the type of laboratory. So as you all heard the presentation from Dr. Moshed, you all know that he works in a reference laboratory in British Columbia, which is a public health microbiology laboratory. So but again, there are other laboratories like a microbiology lab in an acute care hospital setting, or maybe a commercial diagnostic center setting. So there are many settings actually, and the responsibilities might vary. However, and in general, we can say they're involved in consultative services, including test suggestions, test referral, test interpretation, and supervise the entire testing process, test methods, test validation and updates that Dr. Moshed already mentioned. The clinical microbiologists also work side by side with the medical microbiologists, so they need to advise on the antimicrobial susceptibility. They need to produce antibiogram for the patient population. And then microbiology labs typically always have a closely connected to the infection control department of a hospital. So it is also responsibility of the microbiologist to alert infection control and everyone actually, whenever there is highly drug resistant organisms, you found in the lab. So and that's another important thing. And then the job of the microbiologist is also to maintain the regulatory standard, the quality involved in the, and establish a successful quality management program. They need to communicate with other clinicians and external clients, and also the public health laboratories, like the CDC or yeah. And then another other important thing is the laboratory information system, which actually takes up a lot of our time as a microbiologist, because as you know, with the advancement of the technology, so most of the things are digital now. So, and there may be a lot of mishaps happen because of faults or errors in the system. So there need to be always continuous vigilance and validation and evaluation of the LIS. The microbiologists also play administrative role, and they also get actively involved in education and research, which was mentioned. So as I already said this, it may vary by country and the type of the laboratory. Then who can become a clinical microbiologist? I think the
Dr.
answer is
Hassan, you have
yes.
three more minutes. Sorry.
Sure, I think I can finish it because these things are mostly spoken by
Excellent.
Murshid Bhai. So all I want to say that you need the proper education, training, eligibility, and the competency. So, and in US and Canada, there are board certification exams. These are already discussed by Dr. Murshid. I'm not going to elaborate on that. But however, I'm saying that other than ABMM, also, ASCP has some certification. Those are mainly like a specialist in microbiology or microbiology technologist or microbiology scientist. And most of the time, there are various types of options available. These are all in the detail in their websites. You can have a look. And same about Canada, FCCM or specialist in of the microbiology are available. And for ABMM, there are, for non-physicians, there are two plans. One is applicant must possess a doctorate and complete a minimum of 3 years of relevant experience. And the plan two is the CPP fellowship program that has already been discussed. And then, for the non-physician track, the applicants must have a PhD in microbiology or any related subject would work, as long as it is acceptable to ABMM. But they need to be evaluate all the degrees and certain authorities in US and Canada. And then for the experience, either it is a full-time postdoctoral fellowship or an experience in working in a clinical laboratory. So specific requirements, these are some categories. So I'm not going to details, but it includes like, these are all available in the website. I think you'd be able to see them, but there are certain categories and the certain percentage are given for a certain type of experiences they need to be eligible for the exam.
Dr. Hassan, you have 1 more minute.
Sure. So these are the American universities and institutes that offers the fellowship programs. And, this is it is offered once a year and available almost everywhere in the worldwide. This is just a pass rate of the ABMM exams. You can see that. Canadian college exam, and Dr. Murshid already discussed, there are both oral and written exams involved, and they have a syllabus for the written exam that you can follow. Finally, this is the 2016 salary survey in in USA for clinical microbiologist with less than 5 years of experience. And the Canadian incomes are already mentioned by Dr. Murshid. Thank you very much.
Thank you, Dr. Hassan. So we have our first question from Dr. Monwar Hussain. What are the requirements to get a clinical or medical microbiologist position in Middle East? It was also my question. So
Okay, good. Good question. I think at least I can answer this. I have experience with that. So I think the Middle East almost always follows the USA for these things. So, and the value of certification and experience is even more in the Middle East. As you know, Middle East often offers you better salary and advantage, and in return for this certification and the experience. So it's almost same, but in addition to that, you need to be licensed in their own country. Say, I can give you some examples. So I think UAE, say for example, or Saudi Arabia already had their boards set for clinical microbiologists or clinical scientists. The country I'm in right now, Qatar, was not set for non-physician certification, non-physician clinical scientist. However, this thing has now developed over the last few years that I have seen. So I am like in Qatar, I am a licensed, my designation is called LCCM. LCCM means Laboratory Consultant Clinical Scientist. And I did not need any exam or interview or anything. It was given by reciprocity because of my ABMM certification. Same thing about FCCM, I got it by reciprocity.
We have a little bit technical question from Shaheen Ahmed. He
Yes.
probably asked the question about the COVID-19 test, how the fluorescent work in PCR machine in our real-time COVID-19 PCR test.
How the fluorescence works? Well, there are, the lasers inside the instruments, and there are optics there. So, and every cycle of the PCR, as it goes to the amplification phase, the entire plate is scanned by laser with certain, excitation and emission spectra. So it depends on the fluorescence dyes that you are using in your probes. So there may be different colors involved there. Each has its own excitation and emission spectrum. So because the machine reads those by exciting lasers, so these are then converts to digital data, which is now analyzed at the end of the test.
Okay, thank you, Bhaiya. So we have one important, interesting question that was asked by the Dr. Habib Bakht. So you mentioned the consultation with other healthcare providers. So whom do you consult most other than infectious disease physicians? What is the expectation from the clinical microbiology?
Okay, I can give you example. So normally, the way the laboratories work, they're not, we don't always of our own, right? So you're also connected to other hospitals. So say, for example, not necessarily one lab in hospital offers all types of tests. So sometimes, in your laboratories, say you are offering X number of tests, and any other tests, if they're ordered or they're needed for your patient, what did you do? Do you refuse them? No, as a microbiologist, you cannot refuse them if it is clinically needed. So then at that time, you need to send your samples to another facility. It could be local, it could be even abroad. So for us, say for example, we often send samples to other hospital. We call them send out tests. And we also send samples to Mayo Medical Laboratory for more complex tests. On the other hand, from other hospitals, when they need a more complex, say I have some expertise in molecular microbiology, and I do a lot of complex, next generation sequencing and Sanger sequencing based tests. So, however, the main hospital here, although they are the largest laboratory and hospital, they do not have this ability to do this complex testing. So they would try to first reach out to me or one of the other on-call microbiologists, whether we can do that. So this type of interaction is involved with other healthcare providers. And also, as I mentioned, you are also need to interact with the Ministry of Health, the main public health laboratory, if it exists. It's a routine job all the time. You have to do those things.
Okay, thank you, Bhaiya. So we have two questions which are very similar. So I'm going to ask that question. The questions are from Dr. Azom and Dr. Noor Hassan. So the question is like, please share your story on what motivated you to transition from the PhD scientist to the clinical microbiology, and what are the challenges that you faced when you switched from the clinical microbiologist, and how did you overcome? So these questions are asked by Dr. Azom and Dr. Noor Hassan.
Okay, thank you very much for this question. So as you know, I have never planned to become a clinical microbiologist, honestly. So after my PhD was in more in cell and molecular biology. And then I started my first postdoc in UC Berkeley. And I was actually at that time working on an iron storage protein, ferritin. And then, my main goal was, after I have sufficient postdoctoral experience, what I will do is I will start applying for faculty positions. So that was my plan. So then after I moved to Canada, to Vancouver. My first postdoc was on colon cancer. So after 2 years of that, I got a job in BC Children's Hospital in the microbiology lab as a laboratory scientist, which was a kind of a permanent position which we were desperately looking for at that time. Because, you know, after 5 years of postdoc, you get impatient, like when you get your permanent job. Like I think many of you have the same experience. So after joining the microbiology lab as a laboratory scientist, my job was to develop new molecular tests for infectious diseases, validate them and evaluate them. But actually went far beyond that. I started to get myself involved almost more or less every matters in the lab. Although there are like 4 other microbiologists, my senior colleagues I was working with there. And after in that environment, I started liking that job very much, right? Because faculty positions, you know, are sometimes very uncertain, sometimes grant dependent, and many of them starts with tenure track, and then if you don't have sufficient grant, it becomes maybe hard to become tenure. But in that environment, I found that what's bad in it, because you know, it's good. Your salary is kind of locked. It's a permanent type of job, but you have the full opportunity to do research and teaching. You know, you go after your passion. And so I started preparing myself from the very beginning of that work to work towards this actually certification exam. So I started self-training myself with the help of my colleagues in BC Children's Hospital and also the other microbiologists. And when I applied for ABMM eligibility, my boss was more than happy to write and recommend me for all those criteria that ABMM need. So I think that made me eligible right away for the exam, and I could do this. But as I said, that I mean, what I like about this is that, and while it is very clinical, but I have so much passion. I think I spend more time in research, honestly, than my clinical service. But what is interesting is this research is directly tied to like the patient benefit. So I think this is very rewarding. You know, psychologically, I would say, you know, to simultaneously provide clinical service and at the same time do relevant research that may have a direct implication for the patients.
Thank you, Bhaiya. So we have one more question and we have one more minute. So the question is from Dr. Mizanur Rahman. Could you please tell us how a job seeker can get a job in the Middle East from Bangladesh
Sorry, I lost you
related to
again.
microbiology? So the question is from Dr. Mizanur Rahman. Could you please explain how a job seeker can get a job in the Middle East from Bangladesh related to the microbiology?
Oh, I think normally the jobs are posted as it is posted for USA and other countries. You know, the most of the Middle Eastern employers, they work via agencies. So these agencies are everywhere. Like sometimes, like if you have a LinkedIn account, say for example, with proper experience and eligibility, you might even find the agencies are reaching out to you. Like so, but again, you know, there's also again, as Dr. Moshe very nicely said, networking, right? And in most cases, you know, this happens through someone, you know, if you know someone and they need someone, you know, and the person who is already working in Middle East knows someone who already has the certification in eligibility, they would definitely want you to be there. So this is in my case, it was a little different because I was quite happy and set in BC Children's Hospital, but the people I was working with, my colleagues got offer, especially the head of the Department of Pathology, and he was the one who like motivated and convinced us to come with him. So it's not only me, few other pathologists from the same hospital. Murshid Bhai knows them very well, so they came to here, and we actually established the microbiology and molecular lab here from scratch.
Okay, thank you, Bhaiya. It was a great session. Special thanks to our audience for being with us. We welcome comments and questions, and we encourage you to join ISBM. We value your opinion, which will serve allow ISBM to move forward. Thank you.
This is really a session today we had, we didn't have a data results slides, all personal experience, which is tremendously going to help all the audience, including those who are quite with gray hairs. I learned so much. Even in this country, United States, until very recently, all clinical microbiology was taught by medical doctors. But now they are all taught by microbiologists. It's changing in Bangladesh. I'm sure it will change faster. With this is so important. What you want to do first, you have to like what you want to do. You have to love your work. So anyway, that was the comment I wanted to make. This is wonderful. Thank you very much, all the speakers.